Anxiety is the most common mental illness. 30% of humans or so are destined to be seriously impaired with anxiety. There is a chance someone in the room where you are watching this right now has anxiety. Why do so many of us feel this way, and what can we do about it? When anxiety starts to get in the way of your life, that's when it becomes an anxiety disorder. The different types of anxiety disorders can be grouped by the kinds of fears that are involved. Catastrophic fears, these are beliefs that something really bad is going to happen. This includes separation anxiety, excessive fear of being away from loved ones. And then, there are specific fears of phobias. Arachnophobia, glossophobia, ophidiophobia. Fear of evaluation. That's the hallmark of social anxiety, the most common anxiety disorder, a persistent debilitating fear of being watched and judged. And then there is selective mutism, inability to speak in certain situations. Fear of losing control is a big part of panic disorder. You fear the loss of control that comes with panic attacks. Agoraphobia takes this to an extreme. You avoid public places that might trigger an attack. And the fear of uncertainty, of not knowing what's going to happen. This area includes generalized anxiety disorder and obsessive-compulsive disorder or OCD, a fixation on impulse and thoughts. OCD is famous for its rituals. Repeatedly counting objects, checking locks, or clenching your hands a specific number of times. It's all driven by the fear that something bad will happen if you don't do the ritual right. Where do all these anxiety disorders come from? Well, some of it is inherited. If you have a parent with anxiety, you're more likely to be anxious yourself. And women are up to 2 times more likely to have an anxiety disorder than men. Anxiety also seems to have something to do with the balance of chemicals in your brain. Probably the most famous one these days is serotonin. There is a theory that people with anxiety have too little serotonin, the same imbalance that some claim is responsible for depression. People with depression often do have anxiety, but the link isn't well understood. The seeds of anxiety can also be planted by traumatic experiences. Your brain is an association machine, it connects things together. Your brain associates life-endangering fears with very simple things, just because you had a bad experience with it as a kid. Harmless things like water, or even dogs can take on irrational, scary associations. In the past couple of years, anxiety products have become bestseller. The prescription of benzodiazepines, a kind of anti-anxiety medication, has been rising, and Google searches for anxiety are way up. It can be seen very prominently that some of the stigma around anxiety is declining. Most people now see seeking mental health counseling as a sign of strength, unlike older generations. With this rapid growth in anxiety disorders all over the world, one particular culprit keeps coming up.
Social media may be causing more anxiety.
Social media is a fun distraction, but it can actually cause social anxiety.
Social media.
When you are scrolling through your Instagram feed, and you see everyone else's beautiful and amazing life. If you're vulnerable to experiencing anxiety, you might experience it more in that situation. All of the social media platforms out there are designed to hold your attention, and anxiety is a powerful way to do that. Teenagers who spend more hours on social media are more likely to have been diagnosed with anxiety. Worldwide, only about 1/10 of people with diagnosable anxiety receive adequate treatment. Most people who experience anxiety tend to try to just get through it themselves. Some people drink to relax. But alcohol can make anxiety worse in the short term. Others turn to weed, and here, there's mixed results. One compound in marijuana, THC, can increase your heart rate, so that makes you feel more anxious. But there is early evidence that another compound, CBD, actually helps, at least in the short term. There are lots of different types of anti-anxiety drugs. There are benzodiazepines, that makes you more responsive to a sort of natural sedative found in your brain, and there are antidepressants, that help you even out your serotonin levels. One 2015 review of 234 studies compared the effects of doing nothing, exercise therapy, mindfulness meditation, and medication. They found the most effective treatment was a combination of drugs and therapy. One of the most popular types of therapy is cognitive behavioral therapy, or CBT, where you talk with the therapists to alter negative thoughts and behavior patterns. For patients with anxiety, a specific CBT technique is often used, called exposure therapy. In this technique, scenarios are created that activate these fears until you get to the point where you learn that you can actually manage these thoughts, until those associations start to break down. Treating anxiety is much more about learning how to experience anxiety. Anxiety is a feeling of unease, such as worry or fear, that can be mild or severe. Everyone has feelings of anxiety at some point in their life.